Thank you for joining us for our year-end review for the Gravity Project. It is December 12th, and I see that it's the top of the hour on my clock, so we're going to go ahead and kick off with our usual administrative items while everybody gets dialed in and logged in. So we'll go over just a few things like we usually do. Next slide, please, Lisa. We do record these calls, so everyone comes in on mute, but if you've sat in with us before, you'll know that we do allow you to unmute yourselves, or we open the lines if there is an opportunity for questions and comments. And if you would like to pose a question or a comment during the conversation, you can use the chat feature. And if you do that, please send it to everyone, because in the past we've had some great chat conversations. And if you send it to everyone, all of the other people who are on this call can see your question or your comment, and they can respond in kind. And like I said, we appreciate all of you who can answer those questions as they fly by during our conversation. So please feel free to do that today. Next slide, please. And I apologize, it sounds like someone is pounding on a wall next to my office. If you have not already done so, please join the Gravity Project as a registered member. You can do that on our Confluence. And if you can all take just a second to check your devices, we're getting a little bit of background noise here. There we go. Like I said, if you would like to join the project, you can do so on Confluence. Okay, hang on just a second. I'm going to have to mute everybody. Give me just a minute. All right, that's better. Okay, I will unmute everyone when we get ready to chat. Back to this, if you need to check your member status, you're not sure whether you signed up or not, or if you're a committed member or another interested party, you can check that on Confluence as well. Next slide, please. Today we will go through the consensus voting results. I'll run you through that very quickly. And then Evelyn has a year-end review and wants to acknowledge all of our sponsors to date. It's very important that we have help from other people to help fund and spur this work onward. And then Lisa is going to walk you through an overview of the Fire IG review process. Next slide, please. We are here on the 12th of December. This is our last meeting for 2019. It's hard to believe how quickly this has flown by. We are currently internally establishing a schedule for next year, and we will be posting that and emailing all of the folks who are on our distribution list. And once we figure that out, so please stay tuned for details of Q1 2020, and we will be glad to see you all virtually next year. Next slide, please. Our voting results were wonderful. Thank you all for voting. We really appreciate it, and thank you for those of you who so graciously responded when I tapped you with a reminder email. We had 108 votes, which is over 50% of our committed membership at the time that we opened voting. We had 67 yes votes, 19 yes with comments votes, 0 formal objections, and 22 abstains, which is beyond phenomenal. And we are so grateful for all of you providing your input and your feedback. What we're doing right now internally is going through those comments, and we will depose them with either an acknowledged, which means that we hear you, we appreciate your comment, and thank you. An accepted, if you've indicated that some action needs to happen. If we agree or if it makes sense in the scope of this work, we will accept it and we will make those changes. If something comes across that we unfortunately cannot accept for whatever reason, we will tag it with a disposition of considered not accepted. And that can be for several reasons. It's not because we don't appreciate your comment or we don't like you. It's typically because it might be out of scope for right now. It might be something we need to parking lot, or it might be something that is in conflict with what we've already decided in previous discussions, because it's taken a very long time to get where we are. And sometimes we can all forget, or there are folks who have joined the project later in the process who might not have been on those early conversations where we did decide X, Y, Z. So we will assign those dispositions and we will publish all of the votes and all of the comments sometime early next year so that you can review those. Next slide, please. We had a few themes that ran through the comments just in general about adding back the dietitian CPT, about revisiting the verb tenses of interventions for consistency so that they're all past tense, present tense, or future tense, whatever it happens to be. Adding all program definitions to the definitions page on Confluence, which we will be happy to do. We'll be updating that as soon as we can, and making some technical definition changes. So again, we internally will be reviewing how best to handle all of these comments and address them. And we will share the results of that next year with you. Next slide, please. Next steps are to publish that consensus approved food insecurity data set, and our target for that is in January. We will also be publishing, like I said, the voting comments and dispositions. We will be developing a draft recommendations report during the next few months as well. And that will include what we recommend as far as the data set and some other things that will help inform the work that Lisa and the technical team are doing for the FIRE-IG development. And then we will build on that food insecurity data set so that we can use that as a jumping off point for the next two domains, which are housing instability and transportation access. Next slide, please. Are there any questions? And if you are, you may be on mute because I have manually muted everyone. You can star 67 yourself, I think, on your device, or unmute your device if you have any questions, or pose a chat. Okay. Evelyn, I think I'm going to hand the call over to you. Let me unmute you. Please hold.
I'm unmuted. Can you hear me?
Okay, we hear you. Yes.
Yeah.
Thank you.
Great. Thank you, Lynette. Next slide. And good afternoon, everyone. So I'd like to just pause a few minutes again. I know we tend to go quickly through all our presentations because we always have so much content to review with all of you, and we want to have sufficient time to gather your input and feedback. But I'm going to take us a step back, especially for folks that have just joining us for the first time or have not joined us for a while. You may recall this visual, a roadmap. It is on our Confluence page, but again, to reemphasize, what our roadmap was for the year and where we're going. So highlighting as we are in December, we kicked off May 2nd. We've come a long way. We've done a lot of work as a community. So we would like, to acknowledge all of our activities and then give you a sense of what's coming up. So acknowledging that, when we kicked off in May, we focused with the community on developing our first deliverable, which was the use case package. So that was task 2. And then we proceeded onto the food insecurity data set that we have completed. And we're at the point of task 4 now, where we're starting off our recommendations report. We intend to create a recommendations report, or it'll be a buildup of all lessons learned and the coding gap analysis that comes from each of the domains. But we're starting with food insecurity, and we'll have a draft for the food insecurity by early next year, so January, February timeframe. Right now, we also have scheduled housing and transportation. Those are other 2 domains that is part of our phase 1 work. At this time, as Lynette noted, we are still working on establishing set dates to start that work. It also depends on how we fund our current activities for the new year. So that's why those are not definite yet, but we are working on that. But we definitely will have the recommendations report for food insecurity, and then incorporate lessons coding gap analysis from the other 2 domains. At the same time, we're working on our FIRE implementation guide, and so just acknowledging that work is underway, and Lisa will be spending more time walking you through where she's at with that and the specific timeline for this task. Next slide. So our accomplishments. So this is just a recap. Again, I'm a stickler for metrics, and I love to acknowledge all the work we've done. So again, for those that just or haven't joined us for a while or are new, we completed a use case package and went through the consensus voting process, completed that between May and June of this year. And that package includes 7 personas, 1 patient story, and 3 use cases. Phenomenal work too, again, with such a large collaborative. Then we proceeded with asking our community to submit data elements. So again, acknowledging that we got 19 separate submissions We developed 2 forms to gather data elements, and that was through our website, our Confluence. We had an Excel that we walked the community through on how to email us their data elements either via Excel or an easier format. We also developed a web-based data element submission tool that we still encourage you to use to submit data concepts for housing and transportation. So that is available, and that's that second bullet. And then lastly, we adjudicated a total of 423 food insecurity data elements. Again, lots of data elements, and they're broken up there by the specific activities, 203 questions for screening, 60 diagnoses, 13 goals, and 147 interventions. Next slide. We also accomplished consensus, as Lynette just walked through, so I'm just acknowledging that our current the consensus approved and will be published on that data on that Confluence link. But again, that is a significant accomplishment. We initiated development of the Fire ID, again, that Lisa will walk through next. And also very important is acknowledging how many individuals we have convened since May. So we are over 800 participants. So that means at least 800 people have joined one or more Gravity public calls. So we do track everyone who dials in, listens in. Of course, this is not tracking who downloads or peruses our website or the Confluence, but this is just tracking who does officially sign in through the WebEx. And then, of course, our total members. We have 622 individuals that have either signed up as committed members or other interested party. And as we went through our consensus voting, committed members do get the opportunity to vote, officially vote on an artifact or deliverable, while others are still recognized. So again, we use our 622 member list for our distribution and communication. Next slide. So I'd like to also take this time before handing it over to Lisa to acknowledge our sponsors. We would not be here, we could not initiate this work without both our funding and in-kind sponsors. So I want to acknowledge them in terms of 4 areas. We have sponsors that are our project founders. We have our in-kind sponsors, they're recognized as well. And then we have sponsors that have supported us as we've transitioned from a project to a fire accelerator. So we have 2 levels of sponsors there as well. We're also in the process of raising funds for next year. As I mentioned, we are still on hold for housing and transportation until we have sufficient funding to kick those off. So if you are interested in sponsorship or want to learn more about our sponsorship opportunities, you can go directly on our website and submit your interest or send me an email. Next slide. So, of course, the initial founders, we would not be doing this without the significant contributions of the Robert Wood Johnson Foundation and Siren. So they initiated this work, spearheaded it from the beginning, and helped us launch the work. Of course, we also have our amazing in-kind support, starting with Sarah DeSilvi from representing the University of Vermont and the Yale School of Nursing. So we want to acknowledge her organizations. And then, of course, Donna Pertel from the Academy of Nutrition and Dietetics, who has supported us significantly as our co-lead for food insecurity. And now we will have a new in-kind resource from the Academy, Becky Gradle, who will be, Gradle, sorry, Becky, if I mispronounced the last name, but I do want to acknowledge Becky because you will hear her as well because she's now officially part of the fire technical team. So again, we want to recognize the Academy for their significant in-kind support of this project. And then last, we have also the American Medical Association that has provided 4 individuals, subject matter experts to help us again with the Fire ID development, and Lisa will introduce them in her section. Next slide. So our fire accelerator, so many of you may know that we became an official fire accelerator in August of this year meaning we transitioned from our funding from, from our Robert Wood Johnson Foundation set up under Siren, and then moved to become an HL7 fire accelerator. And that level of, there is a sponsorship needing for that. So here we were able to transition as a fire accelerator with the support of Siren again, the AASP, AmeriHealth, and Blue Cross Blue Shield Association. Next slide. And then lastly, we are in the process, these are our current founding sponsors, as we call them. These are the entities that are supporting our work right now, have been supporting us since end of August, and will support us for next year. So I do want to, again, acknowledge their support: AMA, Blue Cross Blue Shield Association, United Healthcare, Jexley, AmeriHealth, and the Office of the National Coordinator. We do have other entities that have expressed interest, and we're just finalizing their agreements. This all goes through HL7. Next slide. I think I paused for question. Okay, before handing over to Lisa, any questions for me?
Alan, can you publicly address Jenny's question that Lynette's handling? That'd be great. Thank you.
Do you want, oh, sorry, let me just hear. Can you provide an update on the possibility of a future pilot? Yes, so we, Lisa will talk about the Connectathon, Jenny. We are also have one of our or sponsors that has expressed interest in being a reference implementation. So we would love to stand up pilots next year after the IG goes through ballot or before it goes through ballot.
And this is Lynette. It looks like Lucy has a question. Lucy, I'm going to unmute you. Okay, go ahead. You had your...
Thank you. Thank you. I think you just said that funding for the project goes through HL7. Did I understand that?
Yeah, so right now the sponsors have agreements with HL7. There's different tiers. And so we've been establishing agreements with them. Not all sponsors have to go through. It just depends on what level of contribution an entity wants to make.
So are there other, other places where an interested sponsor could potentially contract besides HL7?
We can discuss that.
Or something?
Yeah. Right. Like I said, we want to recognize, as an example, our in-kind support, or if there's some level that you want to. So that's something we could discuss offline, Lucy.
Okay.
Right now, yeah. So this is new for us as well. So we're learning this. We're learning this process from how Da Vinci has been set up. The HL7 Da Vinci project is funded through sponsorship tiers. So we're figuring it out that way. But again, we're happy to take any sponsorship. Thank you.
Okay, thanks.
I think there's a question from Jim Camp. Are the agreements in process enough to get to the next stage started? Good question. We'll see at the end of this week or end of next week if the two that are on hold right now, they're not on hold, they're in progress. They're going through the HL7 process and the invoicing process. So if those come through, we'll have to sit down and figure out, are those enough to kick off a new domain, or will those move to continue the fire development timeline? Any other questions? Again, if you do have questions or have other ideas as well, please do reach out to me. We've been we want to keep this train moving. We've got phenomenal support from so many stakeholder groups, and we really appreciate everyone's interest and engagement. We do not want to hold or stop this project for too long. So I think this is why we're accelerating a lot of our funding opportunities right now so that we can have a set timeline for next year and at least educate you all on where we're going. Great, thanks everyone. So back to you, Lisa.
Thanks, Evelyn. Am I unmuted?
Yes.
Terrific. Good afternoon, everyone. This is Lisa Nelson, and we are now going to take a look at our Fire IG as it's coming into being and talk about the review process ahead. As Evelyn said, we have become a part of the HL7 Fire Accelerator program, and as a result, we now are additionally operating under some ANSI antitrust policies that HL7 includes as part of their governance procedures. And under that policy, ANSI requires adherence to principles of openness, voluntariness, due process, and non-discrimination. So it is my job when we do these reviews to remind everyone that Gravity is not a vehicle for individuals or organizations to reach unlawful agreements regarding prices, terms of sale, customers, or markets, or engage in any other aspects of anti-competitive behavior. I would like to begin, as Evelyn said, acknowledging some of our additional team members who are helping on the technical side of Fire IG development. We have some amazing technical wizards coming from the AMA, Monique Van Berkom, Corey Smith, Matt Menning, and Jim Shalaby have been working closely with us to make the progress you're about to see possible, as well as some technical wizards from my MaxMD team, Chen Liu, Natasha Kreisley, Matt Elrod, and we have been joined by Becky Gradle from the Academy of Nutrition and Dietetics, who is working with our content SMEs, who you all have known and heard over the past few months. And this is the team who really is responsible for all of the good progress that I get the honor of showing. I'm going to start with an introduction just briefly to talk about what HL7 Fire is, again, as a standard, and what Fire implementation guides are all about, just in case you're new to the community or it's something that is foundational just to understand. And then we will go into an overview of the Gravity Fire IG development and talk about some of our next steps. What is Fire? The first thing that most newcomers need to want to know is, what does FHIR stand for? F-H-I-R. It's a funny way of spelling fire, but it stands for Fast Healthcare Interoperability Resources. And if you go to the website where this new HL7 standard is freely and openly available, hl7.org/FHIR, one of the first things you see in the welcome box is a place where you can get the answer to that question, what is FHIR, posed in different ways. There's an executive summary to give you kind of the business aspect of answering that question. There's an introduction that answers it for developers who are more technical, or for clinical folks who think about needs and think about the world in a different way, as well as an introduction that's shaped just for architects. And all of those introductions are still many pages long. And so today I thought I would offer another possibility, and that is the answer to this question for Gravity community members. So the easy thing to remember about what FHIR is 3 R's. It's restful, it's about resources, and it's about providing recipes for success. Restful is about the kind of technology that's behind FHIR. This is a next generation standard for HL7. It's the newest standard, and it uses modern technology, like the technology that's used to make the internet go. It's resource focused in that it uses structures that are designed specifically for healthcare, predefined for sharing health information in more standard and meaningful ways. And it offers these recipes for success that are called implementation guides, that are use case driven examples showing how implementers can use FHIR to develop application interfaces that allow data to flow in and out of existing applications. 3 easy R's to remember. I mentioned it's the newest in a line of standards that have come out of HL7. Some of you who know Health Level 7 Standards Development Organization, back in the 80s, they gave us something called V2. That is a technology that's still largely used for sharing lab information and other kinds of notification messaging around admission, discharge, transfer. In the 90s and the 2000s, HL7 brought us a technology that was more modernized. It took advantage of what was available, starting to be available on the web and digital publishing, digital processing of text, a technology called clinical document architecture that taught us how to do organize information in much more meaningful ways, and that's called CDA. It's still in play today. I was talking to Dee Dee Davis from the Sequoia Project. 80 million CDA documents per month are being exchanged through the Sequoia network today. So next kind of evolution of this is keeping up with what modern computing technology brings us. HL7 went back to the drawing board and they gave us FHIR. And FHIR is being developed to combine the best features of what we learned and what we innovated to be able to do with messaging and with documents, but it leverages the latest web technology that's making programming so much easier for programmers who work with modern web solutions, get, put, post, all the kinds of things that just make computing and writing applications so much easier. It leverages all of that, and it continues to apply this really tight focus around API development that's specific for health information interoperability. When we talk about FHIR resources, I'm talking about hundreds of predefined healthcare-related structures that make it easier and faster to implement these FHIR APIs. And APIs, application interfaces, that's really a layer of communication that fits around an existing application and makes it easier for that data sharing to happen. So what you see on the screen is a view of some of these available resources. Just look in this clinical area here, for example, predefined structures that help us rapidly describe structured data for allergies, problems, procedures, care plans, goals, service requests, etc. All of these resources are organized in different groupings that make them very easy to understand and work with, and it's all available on the internet for free. Now, implementation guides are these recipes that I'm describing to you, where it talks about how you take FHIR, which is very open. It's even set for the international community, so it's universal realm in its positioning to be used around the world. It takes those predefined structures and makes them relevant for your realm, for specific use cases that you might be working on. And so the whole idea behind FHIR and these implementation guides is to create a large registry of available how-to recipes that tell you how to create and use these RESTful, FHIR-based application interfaces. I think that's about the simplest 3 R's way that I could introduce and let everybody know what FHIR is and why we have FHIR IGs. Are there questions at this point? Let's see.
Lisa, do you see the one from Lucy?
Yes. Does every EHR have to allow access to information in that EHR? If so, how does HL7 promote FHIR to the dozens of certified EHRs? So EHRs that have existing applications have the ability to write application interfaces and through using these IGs, or I'm going to go back to the resource slide, Lucy, that they can create application interfaces to do whatever they would like. They can do application interfaces, for example, that might give you access to download your specific patient information, key things like get your problem list, get your current medications, They could offer, I'm going to give another example, not so much in EHR. Let me think of a different one. In the case of FHIR APIs for payers, there's another FHIR accelerator program called Karen, and they're developing these FHIR APIs to allow consumers to download their explanation of benefit information. So the FHIR APIs themselves are stood up by choice by the EHRs to be able to support different capabilities. Now, if the support of these APIs is starting to be written into legislation, perhaps as certain implementation guides become available, like one you'll hear me talk about pretty often is called US Core. This is an implementation guide that shows how to retrieve data from EHRs that are associated with those US core data for interoperability that the ONC is using to drive interoperability. So the implementation guides can begin to be required for certification, and that would be a pathway for doing that. But as of this moment, without any legislation released, maybe some that might be coming in 2020, we don't have specific requirements around support for particular FHIR implementation guides, but that certainly is something that could come in the future as ONC deems that these standards are mature enough.
Lisa, do you see the question from Elisa?
Another question from Lucy. So the use of FHIR depends on EHRs to enable it. How can clinicians influence whether that happens? Well, I guess you could ask for interoperability often, suggest that FHIR might be a means for doing that. Some tricks and tips from an organization called IHE, Integrating the Healthcare Enterprise. They encourage organizations to write into RFPs that they develop when they're looking at new technology. You could, for example, include in an RFP a statement that says, we are looking for a solution that supports the US Core FHIR interoperability guide. And then without using many more words than that, you have indirectly referred to a bunch of technical specifications that the vendors that you'd be shopping with would need to demonstrate that they could support. So that might be a technique that could be used there.
Lisa, I'm just going to also, and there's actually the National Academy of Medicine published a report called Procuring Interoperability last year that talks specifically that on the procurement of technologies where health systems and providers can, just as you noted, include a specific language in their contracts and RFPs to encourage the market to use specific standards. I also want to acknowledge, since we have our Office of National Coordinator folks on the call, that ONC encourages, of course, we have the opportunity to submit your public comments to their proposed rules, but they also have the Interoperability Standards Advisory, ISA, that they update every year, and you can also submit comments there. So if there are standards that you are using, or you can include it, to put your public comments there as well. And they do look and read every single public comment.
Thanks, Evelyn. Jenny was asking, to what extent
Lisa,
do the predefined...
this is Lynette. I'm going to have you back up for just a minute. There was a question that flew by from Elisa earlier. Did you see that one?
Oh,
She's
I didn't.
asking...
Thank you very
Yeah.
much. Okay. Is
That's why,
FHIR more like
and to all of you out there, that's why we all track these questions.
Interesting. Thank you. Thank you. Okay. So, Alyssa, I do see your question now. Is FHIR more like a regional health information organization, but aggregating more types of information than a RIO allows? It is a very good question, and I definitely hear people ask this. I think there's even a joke that some presenters use where they ask, well, where's your booth at HIMSS when you're hearing about FHIR? And FHIR is not an organization. So a RIO is an organization that might be positioned to be able to do that kind of data aggregation. FHIR is just a set of rules and standards for how organizations can go about sharing information, but it's not an organization that actually shares any information except for information about how the standard works. It's really upon implementers to invent solutions that use FHIR, and then the implementation guides are the recipes that make it a standard where you can count on other people, other organizations, coming to the table and working by the same rules, so that when organizations go to share data, it's not some big giant project to figure out whether or not it's going to work. The two data sharing partners show up. One's playing one role that's specified by the standard, the other's playing the other role specified by the standard, and they can just naturally work together. So it's not really about gathering data, it's more about helping other organizations gather and share data. Now I'm going to go back to Jenny's question about whether or not these predefined resources help with security and privacy. And there's a whole group of resources that have been created to facilitate this kind of capability. Now, the resources, again, are very generalized, and so you need use cases to come in and talk about how to specifically use them in different cases. And we will be getting into that area for sharing data with community-based organizations. We're going to be using some of these resources like the consent resource. You'll see that as you start getting into the details. So they do help with that. If I'm keeping up, Lucy says, FHIR is not a RIO, yes. And Terry, what is the schedule for adoption? That I cannot answer. You would probably need to talk with your own organization about what's their schedule for adoption. Talk with your EMR vendor and see what they have going on. The Argonaut project, which Evelyn has been talking about, some of our glide paths into utilizing existing IGs, looks at some of the work that the Argonauts are doing. And I believe that right now they have a fair amount of even production use of some of these FHIR-related APIs that allow you to access information. I know my company demos with the Epic and the Cerner sandbox, and Allscripts has a sandbox, but I don't know to what extent it's in production, or how you'd probably have to either talk to your EMR directly. Mark Savage, I don't think that FHIR is limited to EHRs, although that's a common use. Yes, and I gave the example of how payers are using FHIR to give consumers access to their explanation of benefit information. So FHIR is not limited to just EHRs. It was all of the multi-stakeholder kind of community that is out there has been taken into consideration. It can be used by health information exchanges, payers, providers. Patients can even be having patient apps that use FHIR perhaps as a client to access a FHIR server. So it's pretty helpful for everybody. And it's one common language that everyone is speaking and getting on the same page, so that when we show up to a FHIR Connect-a-thon, folks who are working on a problem, if you talk about the allergy resource or the consent resource, everybody always has the same thing in their mind, and you can go and just click on that. It shows you what the resource is defined as, and you can look to an implementation guide to see how it's being used, and it really is opening up a lot of possibilities and making development much, much faster. Okay, 20 minutes. I'm going to move on to the next part of what I wanted to show you guys tonight, and that is our work so far on the social determinants of health FHIR IG. Evelyn did a recap earlier to talk about the work that this group has done to set the stage for our implementation guide. All of that early effort around defining personas, creating the patient story, narrowing and honing in on what our use cases are going to be for this recipe book, and gathering the content that we need to be able to code and share in order to make these use cases work. All of that work really set the stage for our IG, and I'll be able to show you spots where you can see how that's materializing there. The other early work that we did around data element definition, understanding what it really means to define a data element and bring us to the point where we're ready to start to look at these coded concepts and how they are used to represent the information that we want to say. This was all setting us up to be in a position to use a FHIR data structure and know what codes we might use from certain code systems in order to create value sets that constrain data elements that have been made available for us in the definition of those FHIR data structures. So all that early work is what we're making use of now, because it brings us to the place that was the goal that brought us all together to begin with, and that is that we want to be able to share coded social determinant of health information. Without it being coded, we know today that we really can't do what we need to do with computers in order to make processing possible. And not to leave the humans out of this, because we're still always interested in and mindful of addressing narrative text, but being able to share it in a coded and digital way. Our FHIR IG development has been organized into 3 work streams. One focused on keeping this community up to date and educating to bring everyone along. Not everybody has the same background in this community, and so we're trying to do a lot of education and trying to spur adoption with some marketing efforts to get people to use and move on adopting the IG. We have our hands-on Connect-a-thon testing, and we have our IG development and the balloting through the HL7 governance structure. This is task 5 on Evelyn's slide, zoomed way in on these 3 work streams. And you can see where we are today is this community review here in December. We've really been working since early October to bring us to the point of progress that you see tonight. And we are planning 2 more of these overviews to introduce the community to the progress that we're making. We will be experimenting with a Connect-a-thon that's going to be happening in Sydney later on with some of our early use case 1 work. And then we will have 2 more Connect-a-thons this year, one in May, where all 3 use cases will be tested, and again with more mature recipes by September. As we go through documenting all of this technical material and providing the guidance that allows different implementers to bake their own cake without having to have me explain it to them, this IG is very important as a communication vehicle, and we'll be iterating from our first version, which you're going to see tonight, through about 5 different versions of maturation to get to a point that we think that we'll have something that would withstand and be of high enough quality to go for review by the larger HL7 technical community. That would be a September ballot, but mentally noted on your calendar, the real reading work usually happens in August. And then we have a reconciliation process of going through all of those comments and making major revisions to the spec that will take us to the end of next year. This is definitely going to be an incremental process. We see it as an opportunity for the larger Gravity community to learn more about FHIR and FHIR IGs so that you can read them and understand them better. Also an opportunity to learn how to give feedback on these technical FHIR artifacts, which is a capability in and of itself, and then learn how to participate in these Connect-a-thons, which are a really important part of validating our data element representation, making sure that we have the right specifications for our FHIR APIs, both for clients and servers, and to make sure that other people can implement based on what's written down, not just from the direct guidance. I put this slide in here about IG quality because for anybody who's been involved in the past year or two of development of these fire IGs, it's still a fairly new process. And the HL7 community is putting a lot of energy into helping to make sure that the implementation guidance that's created is of sufficient quality that people can really make use of it, and that it is that it's more consistent and correct and explanatory than some of the early IGs have been. So some of the things that we'll be doing over the coming year is really about making sure that our IG is up to snuff in terms of the HL7 quality that's required. The design that we've made, although what you'll see and what you'll be exposed to over this coming year is a single implementation guide that is been tagged SDOH CC for clinical care. It is part of a bigger vision that we have for someday having a collection of fire IGs that are devoted to all kinds of information sharing that's relevant for social determinants of health. And we envision this becoming someday a possibility for having an overarching core technical guide that would capture some of the work that we've done in here that we want to not be siloed in one IG, but to be available for reuse by lots of other IGs, that some of our work would be promoted into a kind of an overarching core technical guidance, and then some new IGs could come along that might address points of view from the community setting, from research, or from population health, different use cases than the 3 use cases that we're focused on. We really believe that acceleration of adoption is important, and that's why HL7 started the Fire Accelerator project. It's one of the techniques that we're using to make this kind of acceleration possible is heavy reuse of other fire IGs that have already been developed. You saw that registry. If you go out there, you'll be amazed how much work has already been done that we can make use of. And so we're going to be able to go faster by reusing the work that's been done in US Core around some of these very basic resources, in structured data capture that gives us guidance on how to use questionnaires and questionnaire responses for screening tools. CCDA on Fire, it tells us how to create encounter summaries in the clinical care setting, these documents that are like SOAP notes to share information that's gathered. Some mechanism, sort of transactional guidance around how to share clinical data through the CDEX IG, and another important IG called bidirectional service request. Very important for our use case number 2 around sharing data out from EHRs to community-based organizations and back again to close the loop. And then a couple of IGs we'll be looking at to do bulk data transfer and some of the kinds of extraction capabilities that facilitate our 3rd use case, which is around data aggregation. So all of this is work that already exists, and our job is to figure out how to reuse it. And then we have our own innovation that's driven out of the work that you guys have been doing on the master list and the kinds of concepts that need to be represented to handle food insecurity, assessment observation, condition, goal, procedure, service request, care plan. I missed it on here, but really the questionnaire and questionnaire response for screening patients. And we have some other resources that we'll be using for workflow around task and bundle and consent. This is what the Fire IG looks like right now. I took a screenshot just in case, so we have it here in PowerPoint. You can see the links. This link right here is the link that launches the IG in viewable mode. You may need to have an HL7 username when you get to this point to view it. We're working on that right now so that you won't have eventually I have a link for you that you don't even need a username to log into, and you'll just be able to see that. And if you ever forget this link right here, I just wanted to remind everybody, we'll do this live, that you don't have to remember that. You just have to remember how to get to the Gravity Project and then go to the Fire Social Determinant of Health Fire IG page, and we keep all of this information, the schedule that I showed you, our milestones and dance card for the coming year. This quick links area right here, the very first link that you see there, you just click on that and it brings you straight into the Fire IG version 0.0.1. Not that I want to set low expectations. It's still really amazing work so far, but it's our first iteration. And this will be up for about a month. Our next schedule of delivery is the end of January for the next revision. But you can go out there and you can click around, begin to read this. There's an introduction that has some notes to reviewers, some things that if you were reviewing it right now, these are things that are on our mind that we'd love to know more about. Just click on that for a second. And it also has the email address where you can write back to us if you want to give us some feedback. We're hoping that everybody will take a chance, everyone who's going to read it, take a chance to look at it before January 8th and get back to us there. It has, let me go back to the table of contents. It has background on the Gravity Project itself and what we're doing, some really interesting work around our conceptual framework and our data modeling that's behind the IG resource profiles that we're developing. And then you can see our SDOH content. This is where our work from the master list plugs in terms of the specialized content that needs to be expressible and shareable around food insecurity. We've got access to our personas and patient stories for background and for, I'll use this material in the Connectathon testing, so we can use Rebecca and the clinic that she goes to and the community organization, the food bank that she's referred to. We can use all of this to develop our test cases, and this is the background information on our 3 use cases. Use case actors, this is the roles that systems can play in data sharing. You can really just feel your way through, have a look. A lot of material is out there already. I think eventually we will have, this is not a mature part of the guide yet, but we will have a security section and a consent information documented in here, as well as some other conformance guidance and some appendices that are useful as resources. So it's really just a open, web accessible specification, easy access, easy for you to read and learn and understand from that. And I encourage everybody to go out there and take a look at it. Let's see if there's anything else I was going to say about that. A couple of unique things that are going on in our IG, and the whole community of Fire IG developers looks to each other to bring innovation, what we're doing. A couple of things going on inside our IG. One is we're evolving the capabilities around modular adoption of other IGs. We're actually working with the folks who are writing BSER to make it very simple, like a 6-point plugin for our IG to be able to utilize and specify some unique things that make it possible for us to then use all the work that they've developed. We are working with multiple Fire IG tooling stacks. Both Forge and Trifolia on Fire are being used to make this IG work across our big team. We're establishing some really novel work around placeholder codes using the content that you guys have developed in the master list. We're taking those definitions and those early data elements and using them in our IG so that we can test and confirm that we have things working correctly before we go back to the code systems SDOs and ask them to create the code. We'll really bring down some of the barriers to new code creation by being able to test them initially. We have some interesting push-based work going on around tasks and workflows that use task notifications, and we are integrating Fire-based structured documents. I don't think you see that in other than CCDA on Fire. We're reusing the work on that. And then we are making sure that all of these resource design techniques we're using a resource design technique that is not siloed. So we don't just look at the development of one resource at a time. We're utilizing our conceptual framework to make sure that the designs of all of our resource profiles work together to give us that cycle of care that we need. And that's kind of a special thing that we're doing too. So that's just a bit about what's unique about this IG. And my last slide is around next steps. In December and January, we're hoping that the community will take the opportunity to click on that link, go look at version 0.0.1 of our IG, look at the questions that we're asking. They're big questions. What are we missing? What else should we consider? Things like that. It's a high-level review. Excuse me. And you can send your feedback to gravityproject@emiadvisors.net. In January, we're going to be beginning our work for planning for Connect-a-thons. So for folks who are interested in participating, we want you to sign up right on this page, right on that SDOH Fire IG page. Sign up and let us know that you're interested so we can be in direct contact with you. And if you could, there's a link for a doodle poll on which days would be best days or which times would be best times to meet. We're trying to just do a little scan of that sub-community and see when we might set up our meetings, probably a couple times a month between now and May. We're working on, we'll be working with the community to just get some more consensus. You'll hear from us at these community meetings around tailoring the information that's needed to go out when you make a referral. We recognize it may not be a full clinical record that needs to be shared, and we're interested in gathering feedback from the community about what is the what is the extent of information that really helps facilitate those referrals to be made. And then in February, we'll be doing some of that early use case testing in Sydney at their Connect-a-thon. And in March, we will have our next big review like this, probably taking up almost a whole community session to just keep everybody up to speed with how we're doing. Short commercial moment for the Sydney, Australia Working Group meeting. You can get more information about participating just by going to www.hl7.sydney. They have a really cool website set up there. You can register. You can see more about where it's taking place. February 4th through 7th is the working group meeting, and the 2nd and the 3rd is when the Connect-a-thon happens. If you can't make it to Sydney, you can still check out our patient care track that is focused on use case 1 and the work of gathering and sharing screening data, as well as sharing structured documents that capture the clinical summaries that hold that structured data about SDOH. So there's a link right here that you can go to get a taste of that Connect-a-thon track. And we'll be having a birds of a feather where we'll find out about more projects like Gravity that might be happening around in other parts of the world. And I'll include that in a report out after we get back from Australia. 2 minutes to spare. Sorry, let's see where we are with questions. Let's see. While the SDOHCC work will it include care plans as one of the fire-based structured documents? Wow, Jenny gets like the prize for questions today. Where did I want to go? The quick answer is yes, and the longer answer is go check out the conceptual framework that is being developed. It's highly, highly focused around thinking about care plans and care plan structures. We have a lot of cool work that's been developed by our modeling resources from the AMA, and care plans are a big part of that. So yes to the care plan work. And will we be formally testing the SDOH data set as part of the NIH NIDDK?
That was Evelyn's
That was
answer,
my
Lisa.
answer. That was my answer, Lisa.
Oh, that we will be testing that
Yes.
as a part of that. So,
Yeah.
okay.
Yeah,
And-
the multiple
go ahead.
chronic conditions e-care plan work will, we are working on a Smart on Fire app and a fire implementation guide for electronic care plans. So it will be complementary to this work. So we do have a requirement to incorporate the Gravity data set. And if you want to be part of those pilots, you can also reach out to me, but that's a separate project than Gravity.
And this is Lynette. I do see that we're at the top of the hour. So Lisa, if you want to go to that last next steps, we would love to wish all of you a wonderful and warm, happy holiday season with your friends and family. We hope you all get at least a little bit of time off or time to breathe. We will be looking for submissions for housing instability and transportation access data elements. And this is something that we can revisit at the beginning of the year for those of you who were not involved in those types of submissions earlier this year for food insecurity. So never fear, there's always more information. We would love for all of you to sign up for the 2020 Connect-a-thon events if you are able. And stay tuned for the upcoming schedule for early next year. And unless there are any last minute thoughts, comments, or questions, we will go ahead and adjourn for the year. Anything else? All right, thank you so much to all of you. Have a wonderful rest of your year.
Happy holidays, everyone. Thank you.
Happy holidays, everyone.
Happy holidays.